Exeter High School has had multiple student suicides in recent years. I have seen both the severity and the frequency of mental illness increase in my 13 years in the field of education. Anxiety is the most prevalent mental health problem in the United States, and suicide is the second leading cause of death for children ages 11 to 18. Mental illness affects children of all ages and is directly correlated with a variety of problems in school, such as social isolation, behavior problems, truancy, and academic difficulties. There are numerous strategies that can be effective for addressing this issue within our schools. It is high time that we tackle this problem head-on. SAU 16 needs to partner with our community stakeholders to develop a district-wide action plan for addressing mental illness in our schools. 1 in 5 kids in the United States suffers from a mental health disorder. These disorders include depression, anxiety disorders, post-traumatic stress disorder, and attention deficit hyperactivity disorder. Children who have behavior problems at a young age are more likely to develop mental health disorders. Early diagnosis is crucial for improving outcomes for children with mental illness. We know that children with depression are more likely to develop substance abuse issues, and children with mental health issues are at high risk for academic setbacks and for dropping out of school. As already mentioned, 20% of children have a mental health disorder, but only 20% of the children get treatment for the mental illness. There are a plethora of reasons as to why the children are not receiving treatment. Unfortunately, there are a significant lack of mental health services available for children. There are waiting lists to get into providers for both psychological and psychiatric care. Unfortunately, many insurance companies only cover mental health treatment for a limited period of time. In addition, numerous children resist or flat out refuse treatment due to the stigma associated with mental illness. Students who receive explicit instruction with a comprehensive mental health curriculum display better social-emotional skills. The instruction should focus on drug use prevention, emotional health, conflict resolution, peer pressure, and interpersonal communication. Not only do our students need direct instruction on mental health, but our teachers need to be trained on best teaching practices for children with mental illness. For example, we know that behavior-specific praise is highly effective. Educating children about mental illness and providing training to our teachers are both viable solutions to address this very pressing problem. Peer teaching is an excellent way to engage our students on the topic of mental illness. We can use students to teach each other and use older students to lead younger students. This has a large impact on the attitudes of students towards mental health. This is a cost-effective and practical model for educating youth on the subject of mental illness that can reduce stigma and create a culture of compassion. Another successful intervention for students is to use the check-in, check-out system. This is a way for students to begin and end their day on a positive note. They build healthy relationships with adults and learn to communicate their needs in an effective way. Students who have connections with adults are much more successful academically and have less behavior problems. Early identification of mental health disorders is crucial. All students should be screened for mental illness on a regular basis. There are screening tools available that are both effective and efficient. School nurses are already existing resources that can implement this strategy with success. This is a proactive way to get students the help they need sooner than later in order to maximize their potential. Students who are identified with the screening instrument can then be referred to a student assistance team and to outside providers for psychiatric and psychological treatment. The screening tool also creates a natural way for school nurses to communicate with parents about the very sensitive topic of mental illness. Operating in a silo is highly ineffective. This is especially true for the issue of children with mental illness. The wraparound approach is absolutely essential when problem solving and programming for students with this profile. Schools should be convening regular meetings with community partners, such as the local mental health agency, emergency room staff, and parents. We have to address the needs of the whole child. Students with mental illness are very challenging and have complex needs. Adults have to come together and use collaborative problem solving. We must prioritize education for our mentally ill students. Timing is of the essence. Directly addressing mental illness in schools benefits all students and promotes compassion, safety, and wellness throughout our school communities. SAU 16 needs to form a community stakeholders group to develop a district-wide action plan.